Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the Public Health Weekly Update with data accurate as of April 20th, 2023. This week, we're going to address a question that is on a lot of people's minds, which is what are these forever chemicals that have been in the news lately? It seems like many newspapers, television shows, and many other sources, radio included, have been talking lately about these so-called forever chemicals. So what are they? Well, they're a group of man-made chemicals called PFAS for short. They've been around for about 60 or actually about 80 years now. And there's important to understand that there's not a single PFAS. There's actually more than 9,000 that have been identified. This will become important later on. According to the EPA, they can be found in a variety of sources, including drinking water, soil, fire extinguisher foam, food packaging, household dust, personal care products, and so on. And according to the Agency for Toxic Substances and Disease Registry, you can be exposed by drinking contaminated municipal or private well water. You can get it from eating fish that are contaminated with PFAS, accidentally swallowing contaminated soil or dust, eating food grown near places that make or dispose of PFAS, eating food packaged in materials, and using some consumer products. And this is not entirely hypothetical. According to a study from the Centers for Disease Control, almost all Americans have been found to have some level of PFAS in their blood, and this is the reference from that. It's been suggested that the amount may be coming down since the two of the most commonly used PFASs have been removed from consumer products for the last 20 plus years. But of course, there are new chemicals being added, and exposure to them is a difficult thing to assess. So why are people concerned about PFAS? Well, they're concerned for a couple of reasons. One, they're very widespread. People can be exposed in many different ways. They can be exposed at different times from prenatal all the way through the rest of your life. There are many different kinds of PFAS, as we mentioned, over 9,000, most of which have very limited toxicological information. They can persist in the environment and they can accumulate in the body. So all of those make it an issue that's very widespread. We're all very exposed to it, and it leaves some unanswered questions. And so according to the EPA, the health effects associated with exposure to PFAS are difficult to study and specify for many reasons, such as there are thousands of PFAS with potentially varying effects. Each one may be different, or they may be different if they affect us at different points in our lives. And because the different types of PFAS may change over time, it makes it very difficult to understand what the impact is. Having said that, there are some suggested relationships between PFAS exposure and health outcomes. They, according to the National Institute of Environmental Health Sciences, NIEHS, they can include altered metabolism, impact on fertility, reduced fetal growth, increased risk of being overweight or obese, increased risks of some cancers, and reduced ability of the immune system to fight infections. But an important point here is these are, again, possible links. The definitive relationships are suggestive, but perhaps in some cases not completely worked out. The EPA goes on perhaps to outline the health effects in a slightly different way, which is reproductive effects such as decreased fertility or increased high blood pressure in pregnant women, developmental effects or delays in children, including low birth weight, accelerated puberty, bone variations or behavioral changes, increased risks of some cancer, including prostate, kidney, and testicular cancer, reduced ability of the body's immune system to fight infections, including lack of ability to respond to vaccines, and interference with the body's natural hormones, and increased cholesterol level or risk of obesity. And here again, these are but probably suggestive. Recently, the EPA released a guideline on 6 PFASs in water. And what caught my attention was the quote in the release was EPA expects that if fully implemented, this rule will prevent thousands of deaths and reduce tens of thousands of serious illnesses. So whenever you see preventing thousands of deaths, it does suggest that there's a significant health relationship, even if it may not have yet been fully proven. So the question is raised, how can you avoid PFASs? Well, in some ways you cannot, but there are some steps that you can take around water, food preparation, cooking, and so on, fish, and I'll give you a little bit more detail in the next slide. And so according to the EPA, if you want to reduce your risk of PFAS in drinking water, first of all, find out how much is in there. Ask your local water utility or have your own well water tested by a certified lab. Compare your results to state standards and contact your state environmental protection agency or health department to find out what actions they recommend. And consider if your levels are high, consider installing a certified filter or possibly using other water sources. It is important if you're breastfeeding to assess the risks and benefits of breastfeeding versus not breastfeeding. And as the EPA says, in weighing the risks and benefits, mothers should contact their doctor. In terms of fish, the EPA does have a website that you can go to determine which waterways may have high levels of PFAS. And in terms of reducing your risk from consumer products, there is a consumer product commissioner's ombudsman that you can contact to assess the risks. So what are these forever chemicals? These PFASs are very widespread. They've been in use for a long time. They're in multiple products that you and I are exposed to. Probably most of us have some low level of PFAS in our blood, but it's important to understand that we don't know definitively what all the health impacts are. I suspect this is an issue we'll be coming back to in future reviews. So please pay attention to PFAS in your life and feel free to share this video with anyone who might be interested. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. If you have any questions about PFAS, I'll probably refer you to folks who know more than I do. But if you have any other questions about this issue or emerging public health issues, please let me know. I look forward to hearing from you. Until next week, please be well.